Welcome to the Business of Healthcare, a twice-monthly podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Britt Berrett. Well, I'm delighted to introduce Peter Baek, a physician entrepreneur who has been focused on a new technology that as we learned about it, thought very innovative. He's an alumni of the University of Texas at Dallas and the Jindal School of Management, and has created something that I think is worthy of consideration. So, Peter, pleasure to have you with us. Thanks for joining us on this podcast.
Thank you very much, Britt. I really appreciate it.
You know, Peter, you've got a fascinating resume. I'm inspired. You trained at Duke, educated at Hopkins. Where are you from originally? Are you from this part of the world, or did we just lure you here to the great state of Texas?
Well, I grew up in Charleston, South Carolina.
Okay.
And then after undergraduate at Johns Hopkins and medical school at Duke, I actually served our country in the Air Force for 4 years.
Well, thank you. Thank you for your service.
Absolutely. So I was in Washington, D.C., Alexandria area from 2002 to 2006. And then once I finished my military commitment, got lured to Texas to live here. It's a great place to live, to raise a family. And so I wasn't born here, but I came as soon as I could.
You know, it is amazing. So you're sitting in the OR, you're an anesthesiologist, and you're looking at all the complexities of the delivery of care, and something got you. What was the issue? What was the big concern?
Absolutely. The issue that we have in anesthesia is there's so many different rules and regulations that we face. And it's all about healthcare and making sure that we're doing the right thing for the patient. At
the right time with the right resources. I mean, efficient, effective, high quality. Totally get that. Okay.
So one of the things that we're required to do is a mundane task, but vital to patient safety, is the proper labeling of syringes. So what happens is every single medication that we draw up from a vial into a syringe, because they're all clear, colorless, look the same, they all need a label. To properly meet all the requirements for Joint Commissions and other healthcare regulatory agencies, that label needs the anesthesiologist or the CRNA to write their initials, the date, the time, all these things that are very mundane and yet help improve patient safety.
And in the midst of a surgical event, that can be overwhelming, it can be complicated, it can be annoying actually, right?
That's exactly correct. It's more annoying than anything else because every surgery we probably do this 10 or 15 times.
Really?
The average surgery requires about 10 or 15 different medications. So you multiply that by 5 or 6 surgeries a day. So a third of your time is spent just handwriting labels.
Got it. Okay. So you thought of an answer to this problem.
That is correct. So what I did was, I have a background in biomedical engineering, where I did a lot of programming. So I used some of my skill set that I had developed in undergrad, and kind of hacked a printer to do this mundane task. So it just does one thing. It simply creates labels that will print out my initials, the user's initials, the date, time, all the information that makes the hassles of practicing anesthesia takes it away.
So a seemingly simple answer to a complicated issue. Why has anyone ever done this before?
There actually are competitors out there. And so when I looked at this, re-examined this about 3 years ago before I started, I kind of scratched my head and thought, do I want to go against these multi-billion-dollar companies that are already well established? What differentiates what I've created versus what's available on the market now is that this was designed by the end user. So rather than to try to please multiple different customers, which, medical equipment companies have to please multiple different players, such as the end user, pharmacists, quality folks. What I try to do is design a system that makes my life easier at the same time it fulfills all the other requirements that the other players need.
And I think that's an interesting viewpoint, because when we look to solve many of the management issues in healthcare, we've got to look at the providers. We've got to ask ourselves, how do you do what you do, and how can we do it more effectively? So you're sitting in the OR, you come up with this idea, and you take it to a real company. Congratulations. How long have you been in existence?
I formed a company in 2015, and 2015 and 2016 were growth years for us. This past year, I've been able to really utilize some of my ties with UT Dallas to help me grow my company.
Interesting. So you're a graduate. So for the listeners, the University of Texas at Dallas, the Jindal School of Management, has a graduate program for physicians exclusively. And what's interesting about it is they bring cohorts of docs together, 40 to 60, and they go through an educational program that is every 6 weeks, a 4-day class. Is that what?
Approximately every 2 months, but it's a rotating cycle of seminars where once you start the cycle, you have about 3 years to finish the 9 core seminars.
I think they're excellent. One of the seminars is actually in Washington, D.C., which I find fascinating. Can you imagine a bunch of docs descending upon Washington, D.C.? And, well, I always find that fascinating. But I got a chance to lecture in that on strategy and quality, and found the conversation embracing, and it does have a significant history. It's got almost a 2-year waiting list right now to get into the program. So you're a proud graduate of the program. You took some of the things you've learned about the business cycle and created the company.
Well, what the program really gave me, the skill set that they gave me really was the courage to actually try to step out of what my comfort zone is.
Oh, okay.
As a physician, we typically tend to be risk averse. We go through years and years of training. The first rule of medicine is first do no harm, which means that you typically try to play it safe.
Yeah.
Right. But trying to be an entrepreneur, you're doing everything but that. You're trying to break the mold. You see a problem, you try to find a solution. So having gone through the program at UT Dallas, it gave me the courage to do it. And more importantly, it gave me a lot of good contacts and ties.
Oh, really? Interesting. A lot of talent out there that you get rub shoulders with. Absolutely.
The as being part of the alumni of the association, UT Dallas, as you know, has the Venture Development Center. And so a lot of the business side of starting a company, things for which I had no idea or how to do, they've been able to hold my hand and say, okay, these are the things you need to do. These are the steps you need to follow so that everything to build up a company.
That's kind of cool. So Vigilant Labels can be found at vigilantlabels.com. And this company now is up functioning. You're in some prestigious organizations right now. You've cracked that code and you've gotten to big facilities. Tell us a little bit about where it's located.
Sure. So right now we're in about 20 different hospitals and surgery centers in the Dallas-Fort Worth Metroplex. Our first customer was UT Southwestern.
Sure.
And we are in every single anesthetizing location throughout their 3 hospitals at Clements and at Zale and the surgery center.
Big academic medical center. And so their position is what? That with this labeling system, they're able to ensure that the right product gets to the right patient at the right time, and that's labeled and recorded in such a way that's irrefutable. And it's easy for the provider to utilize this equipment. Is that correct?
That's exactly correct. What ultimately for the provider, what it allows us to do is to focus on the patient.
Good.
Okay. Rather than take the time out to hand label every single syringe and label, using my printing solution, you can get all the labels in about 2 or 3 seconds. So instead of handwriting it, you use the system, spend your time focusing on the patient.
Does it interface with the electronic medical record, or is it a standalone system?
That's a great question. So initially, one of the things that hospital systems like about it is that it's a standalone system. So that from a cybersecurity perspective, hospitals' IT, they don't have to worry about this at all. There's no way it's not connected to Wi-Fi. It's not connected to the internet. there's no way that this can be used as a Trojan horse to get into a hospital system.
That's been an issue.
Having said that, this past summer, we were able to integrate with Epic, which is one of the largest electronic medical record systems in the country. We were able to integrate with our barcode into Epic, and this is a system. This is what UT Southwestern has been using at some of their locations since the summer.
When I heard about your program, your company, and the product, and the thing that struck me the most was the idea of taking smart business solutions and integrating them into healthcare. That's one of the things that we aren't very good at. And I think entrepreneurs, as you mentioned, are not risk averse. They run towards the fire, and healthcare providers are very cautious and slow moving. And there's got to be a balance in there somewhere. Sounds like you found the balance with vigilantlabels.com. Sounds like you've figured out how to embrace that. Is that true?
I'd like to think so. It definitely was a labor of love, especially since in the initial phase and spending all the time trying to create a system that really I wanted, I needed to make sure that others would also want to use it.
Saw the value of it, yeah.
Absolutely. So, you create, you reiterate. And some of the feedback that I got from the initial tests at UT Southwestern has allowed me to continue to improve the product.
So if I'm a hospital executive and I'm listening to this podcast, I'm saying to myself, why would I spend the time? Why would I put the effort in? I think the answer, to be quite honest, is this is but one of many strategies to improve the patient's experience. And anesthesiologists are sitting in the OR, and it's probably one of the issues that's not top of mind, but if given an opportunity to improve the patient's experience through Vigilant Labels, it's a win. It's a real win. Sounds like UT Southwestern's come to that conclusion.
Yeah, I believe they have. Now, one of the things that happens, of course, is every hospital goes through an accreditation every 2 or 3 years. And unfortunately, it's quite an open secret that the only time that labeling in the operating room occurs is when they're there.
No longer an open secret. Now it has gone viral. So it's I guess that's true. I hate to say it, but that's a possibility that the labeling of narcotics and drugs within the OR is one of those annoying processes that anesthesiologists tend to ignore or tend to avoid, or it's just annoying.
Well, all the above. The above. And I'm guilty of that until I use my system.
So where's Vigilant Labels going to the future? What do you envision?
So, I started this company in the Dallas area since I live in Dallas. We have grown to be in about 20 facilities now. This past month, actually, we have signed some agreements with some medical distributors who have representatives across the country. And we're hoping to go national with our product in the second quarter of this year, actually. Okay.
So we get a chance to watch the evolution of a small, innovative idea, an innovative product, and we get a chance to watch it evolve into a national or international product. That's kind of cool. So let's take a pause right here. Let's talk about the VDC and your involvement with it, because I think that also is applicable. Tell us a little bit about your experience.
Sure. So one of the things that UT Dallas does a really good job in doing is outreaching to its alumni. So as I was reading through my emails, there was an invitation to say, hey, if you're an alumni, student, or faculty, come down to the Venture Development Center, see how we can help you. Cool. So that's exactly what I did. I said,
did you really?
I did.
You just picked up the phone and called them and said, hey.
I didn't even pick up the phone. I just went.
Really?
I did. I still practice anesthesia, so I got out early. Yeah. And I said, okay, here it is. I just introduced myself to Olia and to John Shapiro. Sure. Met with them, and they said, okay, we like what your story is. How can we help you?
See, this is what I love about UTD. There is this belief that academics and professional fields are separate, and there's a big chasm. But the University of Texas at Dallas really looks at bridges. And the VDC is one example of that, where someone who's got an idea, who's sitting in the professional world, says, I need some academic assistance and resources. And the VDC is one of many examples of how that occurs. Easy to use?
Absolutely.
Really?
Absolutely. Very friendly. And then that ties in not only to the Venture Development Center, but also to the Blackstone entrepreneurial wing with, as I'm sure you're aware, with Steve Gingrich and others. It's just been, without them, they've been the catalyst.
So if I'm an entrepreneur and I'm thinking of something as it relates to healthcare, and it's worth just a cup of coffee with them, just a conversation to say, does this really merit further exploration?
Absolutely. What they have is they have about 20 different professionals, not only in healthcare, but patent attorneys as well as others who have given of themselves free time throughout the week to say, hey, if you want to sit down and have a confidential discussion, they're there and available.
No, that's exciting. That's exciting. Well, you've certainly benefited from those resources, but I'm more impressed of your energy and passion around something that's very critical. And well-educated, serve faithfully for our country, but have taken it to a higher level with this new product with Vigilant Labels. This type of product, when utilized within a healthcare setting, is but one of many solutions that integrates the art of healthcare and the integration and the collective support of smart business practices. And I think you've done it here, Peter. So
thank you very much, Britt.
Pleasure having you with us. We look forward to our next podcast, and thank you for taking the time. This is Dr. Britt Berrett at the Jindal School of Management at the University of Texas at Dallas, where healthcare is our business. Thanks for joining us here on the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episodes, notes, links, and more. And be sure to subscribe to the Business of Healthcare podcast on iTunes or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Centers and Institutes tab on the navigation menu. I'm Dr. Britt Berrett, Director of the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.